My role is in work package 5, so I work together with Stuart Anderson as part of the Edinburgh University team, and I'm developing the Scirocco tool, as well as evaluating it. So for now, we've had 4 iterations of the tool. So first of all, I've developed the functionality for assessing the maturity of healthcare systems, then for for consensus making for healthcare systems, then for the maturity of good practices, and more recently, we've been implementing twinning and coaching into the Scirocco tool. And after each iteration, we've also been conducting usability evaluation. I think the value of the tool is, first of all, given by the fact that it brings people with very different perspectives together and it gives them a voice. Also, it encourages them to discuss about maturity. It helps them negotiate and reach consensus. And finally, it allows them to transfer knowledge from one healthcare system to another, or in order to transfer over a good practice from one context to another. So it's a lot about discussion, learning, consensus making, and I think that's the greatest value. I feel that what makes the tool so successful is its simplicity. So its simplicity is given by a combination of using a maturity model, which reduces a complicated problem such as integrated care to 12 dimensions, to 12 very simple dimensions, which allows you to better focus on particular issues. And this is combined in the tool with the graphical representation of spider diagrams, which is a very simple graphical representation which gives you an overall picture of the maturity of a healthcare system or the maturity needs of a good practice. And this makes it very easy to understand what the current level is and to encourage discussion around it. I think the future of the tool is quite exciting. So there are several ways in which it could be extended. First of all, just like Stuart presented in his slides, we could look at subsystems, and from my point of view, we could also look at building communities, so groups of people having different perspectives in the tool and doing the assessment from different perspectives. We would also like to extend in terms of looking at the evolution of an assessment, so looking at how things change over a certain number of months or over years. And also, finally, I think it's very important to take twinning and coaching further in order to actually transfer a good practice from one context to another. So this means supporting, first of all, action plans into the tool, so what the plan is, what the changes that need to happen are in the healthcare system, and then look later on at how these changes, so whether they have taken place, how successful they were, how well the good practice could be transferred over. And at the same time, for the twinning and coaching between healthcare systems, we could look at whether a healthcare system can successfully learn from another and can progress in certain priority dimensions in a similar way.